Hi, my name is Alex Shortt and I'm a consultant ophthalmic surgeon. Welcome to the Optica Eye Hospital London. This is where people come to get rid of their contact lenses and their glasses. So come on inside and we'll show you around. So this is our reception, and when you arrive you'll be greeted by one of our receptionists who will give you some paperwork to fill out and then get you to take a seat, and one of our patient liaison specialists will be with you to start your journey. This is our patient liaison room where our specialist patient liaisons will meet you and explain to you what happens during your 2-hour visit to us for vision correction assessment. The patient liaisons have a really key role in the pathway because they're your point of contact and will pass on any queries or any concerns to me, and we'll also be able to answer all the administrative questions and logistical questions that you have regarding your treatment. So having started your journey with our patient liaison, we now move on to the next step in your pathway, which is your diagnostic tests. So if you'd like to follow me, I'll take you through to the diagnostic suite. So this is one of our many diagnostic rooms. In these rooms we have lots of very specialized equipment and really we're looking at two things. First of all is the health of your eye and whether or not you have any evidence of any eye disease or problems. But secondly, your suitability for vision correction surgery. All of the equipment each has a specialist role, but they all work in a very similar way. What's involved in the scans is we sit you in this chair here and we move each of these machines in one at a time to you like this. You put your chin on the chin rest, your head forward against the top, and you simply look through the air at a light within the machine. None of these machines touch your eye whatsoever, so there's absolutely no discomfort during any of the scans. You simply have to look at a bright light for a few seconds without blinking. So I'm just going to take you next door and show you one of our other diagnostic rooms. One of the unique things about Optegra is that we're able to perform all of the different variety of vision correction techniques, and this includes refractive lens exchange with multifocal lens implants. It includes cataract surgery with multifocal lens implants, ICL lens implants, all 3 generations of laser eye surgery, and even more, but these are the most common types of vision correction techniques. So that requires lots of different technology, and you can see we have numerous machines, and I'm afraid they're all necessary if you want to be able to offer the full range of vision correction surgery. So you've had all of your scans that I'm going to use to determine whether or not you're suitable for vision correction surgery, and indeed which of the various options for vision correction is best for you. The next step in the pathway is for you to come and meet one of our optometrists who are specialists in assessing your vision and your vision correction needs. So this is one of the rooms that our optometrists use, and it contains some specialized equipment for measuring your glasses prescription. Our optometrists are specialists in refractive surgery and understanding what it is that you want to use your vision for. So some patients want to focus on their close-up vision, other patients distance vision is their priority. Our optometrists are specially trained in taking the measurements that are required for me to be able to tell what the best solution for correcting your vision is. So now you're finished with all your assessment and your tests, and it's time to come through to my office, meet with me, and for us to discuss in detail what we can do to help you in terms of getting rid of your contact lenses and your glasses. So welcome, come on in, and we'll get you to have a seat over on this chair over here. So in general, I spend 20 to 30 minutes with each patient, and the consultation takes 3 key steps. The first is for me to meet with you, to get to know you as a person, and also to get to know your visual needs. It's really important that we spend some time talking about what it is that you're hoping to achieve with your vision correction, and also for me to understand what your concerns are about any concerns you have about the treatment. The next step is for me to examine your eyes, make sure they're healthy, and to go through all the various scans that we've done and all the tests that you've had while you've been here, including the optometrist assessment and the diagnostic tests. The last step of the consultation is for me to explain to you what the procedure involves, to discuss the risks and benefits of the procedure, and lastly, for you to ask me any questions that you have regarding the treatment itself, regarding the risks, or anything that's concerning you about the treatment. So now we're ready to move forward to what happens next, which is your day of surgery. So come on with me and we'll take you to the ward. So welcome to our ward, come on through. So when you arrive to the ward on the day of the surgery, our nurses will greet you here and they're going to show you to your own individual room. So come on through and I'll show you one of the rooms. So every patient that comes to surgery gets a room very similar to this, and you have your own private room with bathroom, and you'll have a nice comfy chair to sit on. The nurses will start by checking your blood pressure, making sure you're feeling comfortable and happy, and then I'm going to come and see you, make sure you're feeling confident about the surgery, and we'll complete the consent process. You get to ask me any further questions that you have, and I'll address any of your concerns. The next step is very important. We're going to give you some sedation. So our nurses will give you a small tablet to take, and it will take 20 minutes or so for the sedation to work, after which you're going to start feeling a whole lot more relaxed about your upcoming surgery. This is our main operating theatre. This is where we perform cataract surgery and the refractive lens exchange procedure. So come on in and I'll show you what's involved. When you're having the refractive lens exchange procedure or cataract surgery, we lie you down in a bed like this, and you're lying flat on your back and your head is held comfortably by this cushion. Then we move our microscope in, and there's quite a bright light, and we ask you to look into this light, and the procedure itself will take 10 minutes to perform. You will feel absolutely nothing. Some people feel a little bit of pressure at one stage of the operation, but largely most people say it's less discomfort than having your teeth cleaned. The first thing we do immediately after your surgery is we examine your eyes at this machine just to make sure everything is the way it's meant to be and I'm happy with your treatment. Next, we bring you into one of our recovery rooms where we check your blood pressure, make sure you're feeling okay, and then 5 to 10 minutes after the treatment, if you're feeling well, you're free to leave. Well, that's your vision correction pathway from beginning to end. Your assessment really takes 2 hours to perform comprehensively. Surgery itself, you're going to be here in the hospital with us for between 1 and 2 hours. So thank you for visiting. If you're interested in coming for a free complimentary vision assessment appointment, then please do feel free to contact us on the details at the end of the video. Thank you very much. If you'd like to know more about vision correction surgery, then book a free initial appointment today and I will personally answer your questions.